Let's talk about some common risk factors for developing diabetes. A big one is family history. Now, I always say this first though, you are a victim of your habit, not your genes. So I don't want you to hear family history and just say I'm screwed. That just gives us clues that we need to work on that system for you. And in this case, maybe it's the blood sugar system to really prevent any problems from happening. Just because my dad and his brothers and grandparents had it, and so I'm gonna have that same fate. That is not true, because you can live a different life and you can do things differently than them. So that's where the lifestyle, the diet, the supplements, you can live a very different life and have a very different outcome. It just gives us some clues, okay? But that is one risk factor. Another one is, excess weight. So overweight, obesity, excess body fat, that puts your body in a state of metabolic dysfunction. So it's very hard for it to balance the blood sugar levels. Inactivity. We know if you're not moving and pumping muscles and exercising, you don't soak up and pull blood sugar from the bloodstream. So you need to stay active. And this is walking every day. Walking after meals is incredibly important. I talk about this all the time. 10-minute walks after meals are better than diabetic drugs for lowering your sugar levels. So you should absolutely be looking into 10-minute walks after meals, just walking more throughout the day, taking the stairs when possible, avoiding escalators and elevators. Use your muscles. They will call on glucose and lower the levels for you. This also pushes more insulin receptors to the surface so that you can pull more sugar in. Very important stuff. Weight training, critically important. If you're not weight training and you're not exercising, risk factor goes up. Nutrient deficiencies can also drive this too. You need a certain amount of chromium and vanadium in order for insulin and insulin signaling to happen. So sometimes nutrient deficiencies drive up diabetes. I was at a conference years ago in Oregon where one of our amazing elder doctors was talking about toxins in the environment jamming up the insulin receptors. So this is, forever chemicals, the plastics, the BPAs, all the chemicals that we're exposed to through the food and water supply get into our system. Heavy metals would be another one. And then it basically occupies space on the insulin receptor. And then from there, insulin can't bind. You can't pull blood sugar from the bloodstream into the muscle. And that can start that insulin-resistant phenomenon, which is probably something I should touch on here. Now, this is when your cells don't respond to the amount of insulin that's secreted. So you eat food, blood sugar levels go up. Your body says, let's send out some insulin to clear it. They send out the normal amount, but for whatever reason, the blood sugar levels stay high or higher. And then you're used to seeing, and then it goes, okay, we need to release more insulin because the cells are not responding. And it just keeps going up. And this overworks the pancreas and the metabolic machinery. And as the tissues get more and more insulin resistant, the glands that secrete these hormones get more and more burned out, and that can set you up for type 2 diabetes and the reliance or requirement of medications going forward. So this is what we're trying to prevent. Now, things that raise insulin and blood sugar levels more than others we should touch on, which is going to be your carbohydrates, right? And I know there's your simple carbohydrates and your complex carbohydrates, but let's just keep them in their own basket for now, because carbohydrates in general push blood sugar and insulin more than fat and protein do. So a really good strategy to start considering if you want to balance your insulin sensitivity and blood sugar levels is consume carbs around your workouts or when you're highly active or when you're walking. That way, the activity from the muscles squeezing will push more insulin receptors, makes you a bit more insulin sensitive, and then the muscles can soak up the blood sugar. If you're not highly active, that's when you want to focus on healthy fats and high quality protein, because those keep the blood sugar levels stable. You don't have as many spikes and crashes when you use high quality fats and proteins throughout the day. So that's a really good place to start. Exercise and resistance training, as we already talked about, because the more muscle you have, the more glucose disposal you have access to. So your system can just soak up more if you have more muscle. So building muscle and getting strong is a really good idea here. It keeps you metabolically healthy and flexible. That way you can enjoy these type of foods. You have a lot more cushion for it than someone that doesn't have that extra muscle.